Hello and good evening. This is the second in our webinar series. Jeff, Dr. Morrison, so glad to have you with us.
Great to be here, Rich. Thank you.
I'm here at home in Ottawa in Canada. Jeff, you're in New York City.
Yeah.
Happy Thanksgiving. So I was really pleased to have you join me tonight, and I'm going to let the introductions remain to a minimum. But suffice it to say that you've been a leader in integrative medicine on many levels, both in New York City, where you've maintained a practice with a lot of success for as long as I've known you, which is going on 15 years now. And you've been a leader in the community of integrative medicine at the level of, clinical practice and teaching. We taught a chelation therapy workshop together at the American College for Advancement in Medicine, AAEM. And you were also active at the time with AAEM, and you're now the president of that organization, which has a long and storied history, which I'd love to have you tell us a little bit about tonight. I became friends with you at AAEM, but we also connected at several neural therapy events over the years. And neural therapy became the defining experience for me, for my medical practice, because having come from a background of emergency medicine, which is what I thought what we learned in medical school was best at. I spent 2 years traveling the world studying with traditional healers from many different cultures, and then started a practice here in Canada and attended conferences voraciously, learning many different disciplines. But with tools like homeopathy and acupuncture and natural health products and manual therapy and mind-body medicine and energy medicine, it's often difficult for people to understand what's more important and where should I gravitate to. What's the treatment for me? What's the modality for me, whether as a patient or as a physician? And when I discovered neural therapy, the thing that struck me was that they were treating lesions that no one else is treating. And the notion that these lesions might disturb the regulatory system and lead to complex chronic syndromes that we all treat every day, that we struggle to treat with the tools we have, seemed to me to be a very big idea that medicine needs. And so my work has been leading me down this path, and part of that is in my current role as the president of NAANT, the North American Academy for Neurotherapy. And I really see my mandate and our mandate is as making neurotherapy more accessible to patients who need it by making it easier for the rest of the docs in our tribe, the innovators, the outside the box thinkers, the doctors and naturopaths and DOs and other providers who are going outside of the narrow focus that is guideline based, to find effective tools for these patients. And I think that what AAEM is doing is so important. And the patients that you're treating are in such dire need, whether it's MCAS or POTS or some other name that's given to the dysregulated system, the chronic Lyme, the fibromyalgia, the chronic fatigue, all are environmentally burdened. So welcome, and please tell us a little bit about AAEM and your work with them, and where you're at now.
Well, Rich, first of all, thank you for having me on your podcast. It's it's a big honor to be able to have a chat with you. We don't get to see enough of each other. But like you said, we've spoken at conferences together, and I'm looking forward to us speaking together again in the very near future at the AAEM conference in San Antonio, February 13th to 16th, which I'm going to come back to that. But for people that may not be aware of AAEM, the American Academy of Environmental Medicine, it's about almost a 50-year-old organization. It was founded by Theron Randolph, who was considered the father or grandfather of environmental medicine, and was sort of then picked up by Bill Ray, who was a tremendous physician in the field of environmental medicine and literally wrote the encyclopedia of environmental medicine, a 4 textbook volume on knowing about the toxins, how they affect our health, and sort of gave the whole framework for total body burden, and how there's synergy between different either chemicals or metals, and how that influences our biochemistry for sickness and health. And then other great doctors within AAEM who've continued to move it forward, like Butch Schrader, who has taught at AAEM and sort of gave us a great IV workshop guidelines. We've teach low dose antigen therapy now, which is helping people with food allergies or chemical sensitivities or environmental allergies with under the tongue drops every 8 weeks, which helps to sort of retrain the immune system. And most importantly, we're a community of like-minded physicians that, like you, we recognize that the environment has an impact on our health. And it's not just the environment we live in, our external environment, but it's also our internal environment. And when there's a disharmony with one or the other, that's when our body starts not functioning the way that it's supposed to. Hence, that's why you and I see things so similarly from maybe different sides of the coin, but it's the same coin, which has to do with, optimal functioning of our body. And I think with neurotherapy, it has a lot to do with the nervous system. And we are constantly in our practice trying to figure out whether it's a physical issue or a nervous system issue. And very oftentimes it's both. I think that we recognize that. So at our American Academy of Environmental Medicine, we have a great community. We're a family, and we have a conference coming up that, Rich, you're going to be speaking at, which we're so grateful for your participation, to talk about neural therapy and how that influences environmental medicine. As I said, it's February 13th to 16th in San Antonio, Texas. And anybody who's on this call, we hope will join us to learn about how chemicals in the environment affect our health and what we can do about it. We have a great pre-conference workshop on IV chelation, IV phosphatidylcholine. Also, we're very fortunate to have Dr. Smelka, who's going to be talking about gadolinium deposition disease and using DTPA as a binding agent for people that have had too much IV contrast dye for MRIs. And then we've got great speakers on how, forever chemicals, PFAS, the polyfluorinated chemicals, are affecting our health, and endocrine disruptors and all that stuff. So I just putting it all out there right in front so that we can all think about it, and that'll kind of help lead our chat.
Well, this is just a good example of how, environmental medicine is not just about, desensitization. You sometimes forget, even though you lead with the notion that the low dose antigen therapy is sort of the treatment that sort of defines your tribe in terms of what most people are doing, but you forget that you have to have this solid framework in the broad spectrum of functional medicine to do what you do, right? And so those of us who treat interference fields, the neurotherapists, are seeing problems from the lens of where are the scars in your nervous system? Where are the fried circuits that persist after previous injury or trauma? And how does that cause your regulatory system to misbehave? Because we know that the people who are the most exposed aren't necessarily the sickest.
Yeah,
And
Rich.
there's this curious detective work that has to go into every patient to try to understand what made them sick. And many of our patients assume that their problem is related to the amount of toxicity they have. But as we have talked over the years, the idea that toxins may affect one person differently from another is something we all take for granted as clinicians. We see it every day, but we don't really have a language for explaining it to patients in language that they understand, right?
Well, yeah, and even more to that point, uh, people have tried to uh, have a conversation about what is leading to the problem, whether it's genetics or the environment or the foods that we're eating or the emotional stresses or the uh, or infections.
Or.
So, and I just can't tell you in this field when people are having a problem in getting their health back on track, just like you have said, the whole challenge and the whole objective is to find the underlying cause. Now, it could be multi-level, multifactorial, and sometimes we have to think about numerous things, but very often there's a very significant emotional stress or physical stress, or whether it's a root canal or a wisdom tooth that was removed, or a surgical scar, or a small abrasion, or uh, a, even shots that go in, as we've talked about before. It's remarkable how these things can have a disruptive effect on a person's nervous system, which then, I always tell the patients that your body can't do detox, can't be in rest and relax and detox phase if it's in fight or flight. And so how do you get a person out of that fight or flight response so that he can start being able to get to that healing phase? And a big part of it is helping to remove the obstacle and helping to regain balance. And just so everybody knows, whoever's listening in, I've taken so many neural therapy conferences with Michael Gurovich here in Long Island. And then, of course, I've been to Dr. Kidd's conferences up in Ottawa, and also to some of the neural therapy conferences. Gosh, the last one I was at, I guess Gurovich was the president at the time, and I can't remember. It was in maybe Florida, someplace.
That
But
would have been, I think Michael was a member of the board, but that would have been under Perry Peretz's tenure.
maybe, but
Or maybe Robert Banners.
Well, you have great leadership, thank God, and that's what it takes to have a successful organization. Great, passionate leaders like yourself and your predecessors, but also have a great technique. And that's what's amazing about neural therapy is when you get it right, it is like magic. Just to see the symptoms melt away. Oh my gosh, it's
Well, listen, I have no doubt that this video will be viewed by many of your members. And the one message that I have for them is that, of course, it's great to attend a neural therapy workshop if you can, and that's important. But the resources that we all have in our clinics make it very easy to just dive in. If you have a simple scar somewhere that's even remotely related to a patient's symptoms, I encourage any practitioner who feels comfortable to just put a few blebs of whatever local anesthetic is in your office under the skin. I don't see you necessarily feeling comfortable without having training doing a deep ganglion injection or injecting a tonsil, etc. Of course not. But if a patient has neck pain and they've ever injured their arm anywhere, that's an easy start. A few skin blebs of local anesthetic in a collarbone or a shoulder or an elbow or a wrist can have a big impact on the nervous system. And it's something that is very non-invasive, very low risk. And so I think we're going to be looking for a vehicle to bring neural therapy skills to more people. And I think I'd look forward to presenting a few tips and tricks that anyone who has any comfort level with a syringe and a needle can use to try neural therapy on their next patient.
we look forward to that at our conference, but I also feel like maybe I should share some simple tips and tricks for environmental medicine for whoever's listening in. I'm assuming.
Yeah, the thing I would love to hear from you is how you talk to your patients about reducing the total burden of toxins and allergens in their environment. Because I love what you said. It's not about living in a bubble, it's about building your resilience. But people are still, when they're wanting to get well, they'll travel to see a neural therapist, they'll change their bed and tear down their walls to remove mold. So what's the framework that you give folks? How do neural therapists integrate some environmental medicine in their daily practice?
But believe it or not, I think it's very important to start with some foundational conversations, because it may be obvious, but many patients haven't even done some fundamental things to help reduce the inflammation or stresses on their body. And so no matter what, I'm always starting with the basics of an anti-inflammatory meal plan, which for us is avoiding, at the very minimal, dairy, sugar, and wheat. I know everybody listening here knows it, but as a reminder, please make sure the patients know it too. And I still, my health coaches keep on saying, Dr. Morrison, why didn't you tell the patient to avoid dairy, sugar? I was like, I thought they knew already. But sometimes that can make a big difference. So the meal plan, I think, is important. And then, there's so many fancy tests that can be done to get into more specifics about whether there's actually IgE food allergies or IgG food sensitivities. And then you can get like more nuanced into it. And then number two, I always think that it's really important for people to do some kind of movement, even if it's just walking, because from an environmental medicine standpoint, movement is lymphatic drainage. Every single time a muscle flexes, it's pumping the lymphatic system. So I wouldn't underestimate the power of a simple walk But if a person really had motivation, then like riding a bicycle could be, like a stationary bike could be better, or doing what I would say is restorative exercises like Pilates or yoga, where you're moving the whole body. And then number three, thinking about the mindset or something for calming the nervous system. Very often I'm giving a recommendation on a meditation app, which again, you'd be surprised. So many in New York City, that's one of our big issues, is that people are on the go so much. It's for them to have somebody recommend an opportunity to have space for themselves, even 5 minutes a day, is daunting, but appreciated. And so the app that I often go to is, and there's so many great ones. I know, like Headspace. I like 10% Happier, just because I've tried it myself and I found it was really easy. And they had if a person does the free trial period, they'll learn how to do meditation. And that those are kind of three pillars that are a great foundation. And then, of course, blood tests will be done to look to see if there's nutritional deficiencies or heavy metal exposure. By the way, let me tell you, I am still seeing a lot of people with lead exposure. From our perspective, our red flag goes up if a person has a blood lead above 2. And the reason for that is that the American College of Cardiology did come out with a position statement that said that a blood lead above 2 does increase the risk for all-cause mortality, more so than smoking cigarettes. So keep that in mind when you're checking blood lead levels, because then if it's above 2, you got to try to figure out where are they getting exposed.
Usually, that most of your members are doing some sort of other testing for metals.
Well, it's not mandatory to do provoked testing, though. If people want to learn how to do it, we're going to be teaching it at AAEM. For those that have done it, it's always the question of whether to do the oral DMSA provoked challenge test or the IV EDTA or DMPS challenge test. And now that we're starting to get into gadolinium, there's ways to check for that too. And if a person, just like a quick little simple trick, a 24-hour unprovoked urine, if there's still gadolinium in the urine like 3 months after a gadolinium contrast IV and they're having symptoms, then you may have a problem there, because gadolinium should not be staying in the body. But if it's still coming out in a high level, and that can be checked through doctor's data, urine gadolinium levels. Anyway, so
and so what about avoiding, do you encourage patients to clean their air?
So then we're starting to get into like the specific health issues. For whatever reason, right now, mold is the big issue. I guess it goes in waves. There's like, I remember when Candida was the issue, and Lyme is still an issue. Mold is a big issue right now. And I think coming out of COVID, when people were sequestering in place, a lot of people had mild water damage in their homes, warped floorboards, or water staining on their ceilings because of leaks, or around their windowsills, or they didn't have enough ventilation in their bathrooms. And then, unknowingly, they're getting mold overgrowth. So the first question is that an issue? And so that's easier it's easier to tell you how to check for it than it is to be certain that it's there. Because truly, the only way to really know would be to see it, like if it's behind the drywall or under the floorboard. But people do provoked or unprovoked urine mold toxin tests, and that's to check to see if there's mold toxin exposure. There's also IgE mold allergy tests, which can be done through Quest or LabCorp. And then there's also blood tests for mold toxins as well. We don't use that in New York State because it's not available. So if a person had suspicion about getting exposed to something in their home, like mold, HEPA filters can help a little bit, but the reality is the fungal elements that are suspended in the air really are not being filtered properly through the HEPA filters. They stay suspended. They're too small to be properly filtered through the HEPA filter. And in fact, actually, oftentimes the HEPA filter won't even pull it out of the air. And that's why people sometimes have to do fogging with, it used to be like, I can't remember which chemical is being used right now, but they have non-allergenic chemicals. And I'd have to check my resource list to see, remind me which company we're using for that. But sometimes that has to be done in order to clear a person's living space. Even after the mold's been cleared and the water leak's been fixed, sometimes the air has to be purified with fogging. But if it's like dust or dust mites, yeah, absolutely, HEPA filter is great. Or dander, cat, dog dander, that's makes perfect sense. Especially right
What
now,
about people? Sorry, go ahead.
especially this time of year, because people's heats are coming back on. And so surprisingly, the dust on the heating unit gets liberated when the heat comes back on. And that's when everybody's nose starts getting stuffy, like with the heat. Also, don't forget that the air gets dried out. So warm mist humidifiers can be a great option to help decrease the risk for infections and allergen issues. But yeah.
Yeah, one of the things we talked about earlier was something that I think is a great pearl for tonight's conversation for anyone who wants it. And we talked about how inhaled allergens are more likely to be a problem if you have interference fields in the nasopharynx or the respiratory tract. The notion that an interference field in the lung or in the sinuses or somewhere in the throat or the anterior neck might make you more prone to sensitivity to the microbes that would be in those spaces. So I raise that issue because, I'm sure you've seen these patients who had placed their hopes on their home renovation project. And they were heartbroken when their symptoms did not improve after removing or remediating the mold in their home. So how do you approach that conversation? And, do you have any comments on this notion of interference fields in the head and neck being linked to hypersensitivity to airborne allergens?
Well, obviously, that's when I would be referring to you, Rich, because I think you do much better job of assessing the body for those interference fields. But I can definitely, like the rare times that I do neural therapy, like doing tonsils, which are so easy to do once you learn how to do it. It's so remarkable how like people stop getting upper respiratory infections. Like when they were having chronic colds every single year, it's so crazy. Doing either the tonsils or the lung points. Yeah, it is really quite remarkable. But it's basically about history. Did a person have their tonsils removed when they were younger because they were on recurrent rounds of antibiotics? Do they still have their tonsils and they still getting pus in their tonsils? The crypts. But yeah,
I want to get you on that question about the home renovation, because tell me how you advise your patients whether to do the home reno project or not. Are you
if
are
a
you
person has,
confident that it's important for folks to do this, and where does that fit in the list of things to do?
so if a person has the symptoms of brain fog, difficulty concentrating, memory changes, and we do do a mold, if a first morning urine mold toxin test and it's elevated, and if we find those molds in the home, like penicillium or stachybotrys or aspergillus, yes, I believe they should have that remediated. That's for sure. Uh, and you'll be it's not unsurprising that people will go back. In fact, sometimes we have people that have to go back 2 or 3 times to find where that leak is. The leak has to be fixed. And then if the mold is not taken out, it's going. And so here's where you're coming at, Rich. You know, why is it that one person in the family is getting pretty sick with the mold and the other person's not? And, you know, I think in the environmental medicine field, we think it's genetics. But in the neural therapy world, there's more to it.
Gives
And
you an easier answer.
yeah, it's, in fact, I think that like this is what's going to be so important about what you're going to bring to environmental medicine to the AAEM talk in February is helping people to recognize there's more to genetics, to a person's individual response to stresses, environmental stresses, toxins. And yeah, they should, I think, get rid of their mold. But if they're not getting better, they got to figure out what is it in them. And genetics, you know, I you know, it's so easy to hop on that bandwagon because it's like the latest greatest testing. And there's no question that there's a role for that, you know, especially now that we're seeing a lot of these new cancers that are popping up that are very genetically related, you know, especially metabolic genes or, you know, tumor suppressor genes that are affected, et cetera. But and you know, and when you look at the genetics and you see people have glutathione SNPs or you know, phase 1 or phase 2 liver detoxification enzyme issues, it makes you think, let's optimize it. But that never is perfect, never. And that's what goes back to what you're saying. You're right. You're right, Rich. It is
It's not
such
the whole
a
story.
big piece, such a big piece. And but also the people know it. People know that their nervous system is on fire. They're not just on fire, they're wired. They're hyperactivated. And
Tired and wired.
and then they cannot get out of the loop. And so it is a detective hunt. But what you bring to the table with the better body assessments of being able to kind of find where the interference fields are, and but you know, it's no one person has all the answers, but if we are not aware of neural therapy, it is a huge missing piece, a huge missing piece. So that's why I'm thankful for you. It's Thanksgiving. I want to give thanks.
Well, I'm thankful for you too, Jeff. And I'm definitely aware that um, when we meet in San Antonio, although you and I always end up talking about politics, we always agree that we prefer to leave the politics out of medicine. We're going to be together at a time when you cannot take politics out of medicine. So I, as a Canadian, have observed the difference between the approach to integrative medicine in Canada and the US. And I definitely am thankful for the freedom that you all enjoy. But I think there are a lot of people who are nervous about the changes that might be coming because you could not ask for a more revolutionary approach with the team that has been put together. And I'm not sure what they're going to do, but I assume that AAEM has always been a politically oriented organization because a lot of legislation is related to where these toxins are coming from in the first place.
Well, well, let me just say, because AAEM is a non-for-profit, a 501(c)(3) whatever, we cannot be advocates on a governmental level. But We definitely put out white papers, educational resources for the community. For example, we have a great piece on fluoride, which has become a very popular, very big topic in the United States recently. And I think even just it was brought up again because RFK was bringing up whether it makes sense to have mass fluoridation in community water systems. And the AAEM position on this is that it should not be. And for anybody who's interested, it's go to our website. There's a great, well-written, not terribly long white paper on the risks of fluoride. And but we believe that our members should be aware of what's happening politically, and we have tried to partner with lobbying organizations like the Alliance for Natural Health, ANH, which has been an advocate for integrative medicine practitioners for 20 years at least, and they're still going strong. The president is Ron Hoffman. He's a very strong advocate as well. He's recently stopped practicing medicine just because he enjoyed a long career, and now he wants to shift his energy into other areas. And one of them is ANH. So I'm hoping to get him down to San Antonio because I think it's really important for exactly what you're saying. Who should we be speaking to on the national level to help affect proper change within the government? And nobody knows what this new leadership group is going to bring to the table. We hope that it's going to be for healthier food and more awareness about what toxins should not go in the water or in the air, and certainly allow doctors to practice medicine based on what they were taught to do, which is learn about their patients, help treat them for the problems, and help them to get better. We want to see the government sticking to the practice of governance and allow doctors to practice medicine. I think that's our goal.
Yeah, I think physician autonomy and healthcare freedom from the patient perspective are really important values that we share. The idea that medicine should be administered by bureaucrats, and that a top-down approach to treating disease just doesn't make sense, because the truth is that every person who has a diagnosis probably has it for a slightly different reason and needs a slightly different approach.
Right. We absolutely, Rich. We totally are in alignment on that. Unfortunately, right now, the way that the practice of medicine is heading, this goes back to what we were talking about at the beginning of the conversation, which is that us like-minded physicians are becoming fewer in number. And that means that we have less leverage, less of a voice. And hence, that's even more important why we need to bond together as a community through our like-minded individual organizations, so that our voice can be amplified. We all have our focus, but we all are independent practitioners, and there's fewer and fewer of us because the hospital systems are making all doctors employees. And once a person becomes an employee, the motivation kind of changes. Of course, it's always patients first, but I think that when a person's in an individual practice, there's an even more heightened sense of how can we get that patient better. And I think that's one of the things that I know that we pride ourselves on, going to the furthest mile to help our patients, and whether it's with me or with you or with whomever, we want to find the right people to help a patient on their healing journey. So, and by the way,
Sacrificing our personal time to attend conferences and lead organizations and have conversations like these, or even like our colleagues who are on the line tonight, to give up your Sunday to learn something new. This is a labor of love for sure. But I think it's great to hear that Ron Hoffman is diving into the Alliance for Natural Health. I do think that collaboration between our organizations is super important, not just because I want environmental docs to treat interference fields and you want neural therapists to be mindful of the environmental approach that they need to take to all their patients, but also because we need to work together to achieve common goals.
yeah,
Because I
absolutely.
agree, the healthcare system is changing, and integrative practice is becoming marginalized.
Having the awareness really is a big asset in helping to find a path for the patients. And that's why I love, and by the way, another reason I love going to neurotherapy conferences is because there's always doctors that want to practice on me. So whether I can get this injected or that, and then of course I get to inject some things too, which I love, but we got to take care of each other. That's really what the bottom line is. And we are. And hence I think it's just going to become more and more important in these coming years. By the way, I see Michael Gurvich put up a question. I want to make sure that I answer it. Thank you, Michael, for joining tonight. I miss you. I hope you're well. It's been a while since I've seen you. He asked for more specifically how about testing for mold in New York State, and I think what he means is how to test the home for mold. And there's a number of ways to do that. Uh, Inexpensively, a person could go to Home Depot and get home testing kits. There's a company that we use that we recommend patients use called Immunolytics, which will send agar test plates to patients' homes, and then they'll be on the phone with the person and help them figure out where to set them up and how to do it. Usually I just tell people to keep the plate open for 24 hours, close it and see if something grows, and if something does, send it back. With Immunolytics, you only get charged for what they check. So they can send you kits, those test kits for free. Then you have to pay for what they test. Then next level testing is like doing ERMI testing, which is an environmental relative mold index, which you can get through a company called Mycometrics. And that is a little bit more sophisticated. It's like swifting with a cloth on surfaces. There's good and bad with that. It's kind of like looking at a historical perspective on what has been in the home. It doesn't necessarily say what's there right now, but if you see Stachybotrys there, that's probably not a good thing. So you might want to take a deeper investigation. Third, you can get a whole home mold inspector. And the best thing to do is just try to find a good one in your community. There's certified mold inspectors, which we've used. But we use a lot of different ones. And I always give people 2 mold inspectors because no one's perfect. Truly, the best thing is to have a direct visualization and see. And that's where you sometimes need somebody to come in and do like humidity readings on walls and floor. So I hope that helps. And then
I've seen so much variability between mold inspectors. Is there someone who certifies them? Is there a standard approach that has been adopted? Or is it still kind of a Wild West in terms of how people operate?
so great point. If this is where there is the nuance of finding somebody who's a clinical ecologist. And that is a specific extra level of education that a person would have to go through, which does not mean that they well, they're still can be certified to do mold inspections, but clinical ecologists are usually doing it to a much more sophisticated level. Like they'll know where to look quicker. So that would be the question to ask a company, because you're right. There are a lot of companies that are just doing home mold inspections, but they're just doing it because they fell into it one way or the other, and but they may not be so sophisticated. Clinical ecologist. Yeah.
Interesting. Yeah, and the field is a moving target as technology evolves and our understanding changes. Um, Certainly, I think that most of our patients now understand that whether it's toxins or mold or parasites, many more of our patients now understand that their problem is not that they have too much, but that they're not reacting properly or they're overreacting to it.
Yes. Yep. 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 You said that right. It is. It is. That is what the whether it's EMFs that are contributing. There's so many stresses on people's bodies now, and I'd be curious. Do you see that in the patients that you're starting to see in New York State or New York City? Are they having different reactions to your neural therapy than in Ottawa? Because there might be a little bit of a different type of stress from their environment.
What I find is that the patients in New York are coming from a different place. They have a different set of pain points because they've had a different experience so far. Because in Canada and in Ottawa, of course, the patient experience is definitely colored by the barriers to access. And I think maybe in practice in New York, we see patients who have the ability to pay for their care. Uh, my heart goes out to people who are struggling with illness, regardless of who they are, but it's that much harder if all you can afford is Medicare and your Medicare doctor is struggling to figure you out, and you can't really access other resources. But in Canada, we don't have the option to pay for care that is insured by the healthcare system. So you can see an integrative doctor, but you can't pay extra to see an internist tomorrow, or an allergist next week. So many of my patients have had to wait 9 months for one specialist and 6 months for an MRI and a year to get another answer. And it's been years before they see me. The patients in New York have seen 15 doctors, and they've had all the testing. So the ones who've slipped through the cracks, they do so for different reasons, typically because they have interference fields.
Yep.
And again, I think in New York, many more people have access to an excellent organic diet. They may have access to all of the natural health products and all of the best practitioners, but many of them are able to walk everywhere, so they get their physical activity much more than where I live now, which is a driving city, where many more people struggle to get their 10,000 steps in. But they may not have as much stress to deal with as the folks in New York, because everyone is go, go, go. And this was one thing that I recognized, is that nobody sleeps at night in New York. It's very hard to find a person who sleeps through the night.
Yeah, I always personally thought that when I was seeing patients that came in from out of town, they would respond quicker to whatever we were doing. versus New Yorkers who, for many reasons, many of what you've stated, not sleeping through the night or stress from work or working too many hours, or I mean, even though the food could be clean, they may not be spending too much time eating it. They could maybe just eating quickly. So there's a lot of interference fields to deal with in Manhattan.
Well, and the other question I wanted to address was related to restrictions practicing in New York State. One thing I know is that we both do chelation therapy, and one of the things that I do is I will add some neural therapy to that procedure. So when you're doing metal detoxification, you're primarily draining the kidneys, and so some segmental therapy over one kidney or both kidneys, just a few quaddles under the skin over the costovertebral angle on both sides is that's how I do chelation therapy. And I know that there are some drugs that you can access in New York State and some that you can't. Is that correct?
Which one do you think you cannot get here?
Do you get zinc DTPA?
Well, yes. That's a little bit you mean the DTPA? Yeah, I think that's the one that we just recently could not get. I think we're only getting the calcium DTPA.
Okay.
And I don't
Because
even
we can't get that one either in Canada.
it's that's why I'm looking forward to seeing Semelka speak, to see where he's recommending we get the extra ingredients, but I'm not sure that it makes that much of a difference, to tell you the truth.
And in terms of the functional testing that you need to do from day to day, do you feel limited by what you're allowed to do in New York State? Are there any specific tests that you feel like it should be a priority to get access to, if possible?
I have kind of taken the approach of not being too upset if there's tests that I'm not able to get. Like, yes, I wish I could get GI map, but it's not available, so we use other tests. Or we can't do hair analysis. I'm not going to be so upset about it. If a person really wants it, they can go order it from Rupa Health or something. There's and food IgG allergy testing is not really easily available in New York State. Yeah, it would be interesting. Recently, I was surprised to find a metal allergy test that was available in New York State, which I had been looking for forever.
Okay.
And it's available through an orthopedics company because they want to do pre-op nickel and cobalt allergy testing. I'm going to have to let you know at a later time. I don't know it off the top of my head. Let's see, metal allergy.
I have a comment from the chat that EnviroBiomics has good customer service. They do ERMI testing and Hurts Me Too testing. Tell me about, I'm afraid to ask, what hurts me too?
That's funny. So there's orthopedicanalysis.com is the metal allergy testing, and that's available in New York State.
Okay. Have you heard of Hurts Me Too testing?
Yes. ERMI and Hurts Me Too, they kind of go together. Oh, Dr. Tao was saying it's from EnviroBiomics. I use Mycometrics for those, but either one's fine.
They both use that.
It looks like customer service.
There was a question about whether lidocaine works as well as procaine. I think there's maybe no more controversial question in neurotherapy. So Jeff, this is a good opportunity for me to segue into one of my pet projects, which I look forward to collaborating on if possible, and that is the notion of outcomes-based research as so important for advancing both of our fields. The notion that with a smartphone, you should be able to document a few key points that tell me what you just did to your patient. And that same app would be able to prompt your patient to tell us whether they're feeling better from one day to the next. This will allow us to crowdsource evidence so that of the 10,000 practitioners who are doing neurotherapy, if we find that those who use lidocaine get outcomes that are equivalent to those who use procaine, well, that's a compelling answer. The answer I can give you now would be my opinion. And there are many who believe that procaine is the sine qua non of neurotherapy. And of course, we know now that local anesthetics don't just work by blocking sodium channels. We know that their affinity for many receptors, including NMDA receptors, serotonin receptors, vanilloid receptors, leads each local anesthetic to do different things. And there's been a lot of attention given to the fact that procaine has more of a sympatholytic effect. It binds strongly to sympathetic fibers and their receptors. But I haven't seen any solid evidence that neurotherapy is more effective when it's done with procaine across the board. What I have seen is that some patients respond better to one drug and other patients respond better to another drug. So I think in my practice, there's procaine, there's bupivacaine, there's lidocaine, and there's ropivacaine. And in some cases, there are combinations of one or two or more drugs. So I think in the same way that you have members who do their desensitization using one approach and others swear by another approach, and it's more a matter of opinion than science. Would you agree?
Yeah, yes, yeah, certainly. And as you're saying that, what comes to mind in environmental medicine is the conversations between whether people are doing low-dose antigen therapy, LDA, or low-dose immunotherapy, LDI, with Ty Vincent's program. And, there's probably room for both. Definitely, they both work. Yeah. But it's good to have these kind of conversations because it's always about trying to find the right fit for the patient.
Absolutely. I'm gonna touch on one last thing. I know we're nearing the end of the hour, and of course we're not limited to an hour because this is not a work day and we don't have another Zoom call to go to. But I do want to give you the rest of your evening, and I want to let people get back to Thanksgiving. But you mentioned fluoride, and I'll share a pearl and then I'll ask you a question. One is the notion that many of us treat patients who have sensitivities related to their thyroid or to their sex glands, whether they have ovarian cysts or they have growths in the uterus or they have nodules in the thyroid. The link between iodine as a therapeutic agent and potential toxicity with fluoride and bromide and other halides. So from my side, neural therapy to the neck is a great approach because the thyroid is innervated by the same structures that are affected by a whiplash injury. And can be affected by collarbone injuries and tonsil injuries and lymphadenopathy or mastoid congestion. So anything in the head and neck can be relevant to the thyroid. But how do you all approach that issue with regard to halide testing, looking for toxicity and assessing that patient? What have you seen at AAEM and what's your approach?
Well, I don't really think that there is a formal test for fluoride testing. That is a big hole. Nobody, I do not know of anybody who has it. I was having the same exact conversation with Lynn Patrick, who's been thinking about this in even more detail than I have. And the big concern is, number one, there's no great test, and there's no great treatment. Aside from what we're talking about right now with the potential that iodine could be the solution. But, you know, people bring up the potential that iodine could create a thyroid storm situation, which I personally have never seen. When I was when I was younger in my practice and a little bit more of a maverick, I did use very high dose iodine. I was doing the 25 milligrams twice a day. That was the Brownstein protocol. And and maybe I just didn't do it in enough patients, and thank God everybody did fine with it. I didn't see anybody really making a lot of progress with it. I didn't see anybody having any harm from it. So nowadays, I do not use that high dose protocol. I don't have a better strategy for fluoride, except to say that I would probably put I would check their iodine status and make sure that they're at least, which you can do a urine, just either a spot urine or a 24-hour urine iodine. And if they're low, certainly replace it. And I just use either Somaplex iodine liquid drops, 30 drops twice a day, or Pure Encapsulation makes a iodine that's at the RDA level, and just use that. Maybe it's, I think, 1 milligram or something.
So, you touched on so many things, and we talked about so many options that people have in terms of things we could recommend and things that people could try. So I would like to maybe close this with asking you to comment on rational prescribing. This is the notion that you want to try something, you want to structure a therapeutic trial. You say, we're going to try this for X number of days, X number of weeks, X number of months, and we're going to decide if it worked or not. And if it worked, we're going to keep doing it. And if it didn't work, we're going to try something else. And your journey is going to consist of one trial after another until we figure you out. And I'm going to be your guide. I'm going to be your coach, but this is your journey because this is the best we've got right now.
Yeah. Well, I'm an advocate for that. I think the way that I approach it with the patient and with the chart are similar. Most often when patients are coming to our type of practice, when I say our, I don't mean just my practice. I mean probably yours, Rich's, and many of the other practitioners that are listening in. They have tried so many different things, and we need to find a solution. So to the best of my ability, I'll explain what the options are, and I want to make sure that I document that. Risk, benefits, alternatives discussed with patients, and then explain what the goal is, both to the patient and document in the chart. And of course, talk about what the possible side effects could be. The classic is like, if a person goes on testosterone and isn't aware that it could cause hair loss, they're not going to be happy if that happened. But in this case, if a person's doing chelation therapy, I tell them it's going to be used off-label for their purpose. The hope, we found elevated levels. It's not conventional that, in fact, the occupational medicine doctors do not believe in body burden. They don't believe in chronic low-level exposure causing a toxicity issue. And I document that and explain to the patient. And then if the patient understands what we're talking about and they want to go for it for the objective of helping with their symptom, like the fatigue or the brain fog or the numbness and tingling or rashes, we've helped people with psoriasis for this. I think absolutely.
We're not treating your symptom, but we're using your symptom as an index of improvement.
I love the way you said that. That's very well said.
Excellent. Excellent. Well, I look forward to being with you in Texas in February. Who wouldn't?
February 13th to 16th, go to AAEMonline.org.
Right on.
And sign up.
And we at NAANT will not be having our annual conference in April this year. I saw that question in the chat. We'll be back in 2026. Until then, you'll have the opportunity to attend small hands-on workshops with excellent teachers whose workshops will be on our website as soon as their dates are confirmed. There are a number of teachers on the West Coast. Jeff Harris, Ilana Gurovich, and Ann Hill are teaching. And I'm doing a workshop next week in New York at Dr. Gurovich's office. And we're hoping to announce some small group workshops on the East Coast for 2025 soon. So visit us at naant.org. Until then, we're going to be focusing on building our provider network. And that includes members who can do neural therapy and physicians who know enough about neural therapy to be able to counsel patients about how treating blockages can be a part of their care. So for those of you who will see me at AAEM, I hope to share how you could introduce a few simple injections into your practice that can tell you whether neural therapy is right for that patient, and how to work with other providers who can help you deliver a more blockage-based approach.
I can't wait to see you. And for people that want to learn more about environmental medicine, come and learn about chelation with EDTA, DMPS, DTPA, high-dose phosphatidylcholine IVs, and then, of course, about all the other toxins like the PFAS and forever chemicals, endocrine disruptors, mold. Hope to see you there.
Lots of good stuff, good science, good functional medicine. Thank you so much, Jeff. It's been great to spend some time with you, and I look forward to being with you soon and to doing more sessions like this again and collaborating towards a common goal.
Likewise, Rich. Thank you. We're better together. That is for sure.
Grateful for you on this Thanksgiving weekend. Good night, and good night to all our viewers.
Good night.